on the looking at the dissected leg, again, posterior side, or probably better to look laterally and just make sense of this, because they have given us the entire half of the pelvic girdle. You can see the cut lumbar and then sacral vertebrae, and then the rest of the pelvic girdle would come out this way and around to the pubic symphysis right here. So we're looking into the pelvic canal here. And so if we come and look now posteriorly, where the exit from the pelvic canal would be the floor of the pelvis. Of course, we don't have any of that in place. Well, now we want to look at the limb muscles on the back of the leg. We're going to see this is actually the bony part of your buttocks, extending posteriorly, the ischial tuberosity, and they've cut the very large gluteus maximus muscle and pulled that away, and we've cut also the gluteus medius muscle, so that we can now look behind there and again see those medial and lateral rotator muscles. There's just a beautiful view of that piriformis muscle, and there's the sciatic nerve coming down the back of the leg. But if we look back into the pelvic canal, we can see where that sciatic nerve has its origin from the sacral plexus, the sacral spinal nerves coming off of the sacral, from between the sacral vertebrae. Again, through that sciatic notch, and the sciatic nerve continuing down, doing the hamstrings on the back of the thigh, and then continuing all the way down to spreading. It actually turns into a fibular and tibial nerve to all of the muscles from the knee on down, posteriorly and anteriorly. Other muscles, again, the ischial tuberosity with its chicken foot tendon and the 3 hamstrings coming off of it, going to either side of the tibia here, and then from the tibia, the heads of the gastroc, or actually from the back of the femoral condyles, the heads of the gastroc muscle. They've cut this one here, it continues here, the soleus muscle, to form that whole triceps surae muscle across the back, coming together at the Achilles or calcaneal tendon. Around to the front, looking anteriorly, again, we're going to have, like on the torso, we're going to have the cut end of the abdominal wall, ending at the inguinal ligament, from the pubic symphysis back to the pubic symphysis to the ASIS, and from behind that inguinal ligament, coming behind it, we're going to see the femoral artery and the femoral nerve branching out to they cut a couple of them. They cut muscles, vastus muscles of the quadriceps group. That big quadriceps group is going to incorporate the patella tendon, the patella in what's called the patellar tendon, and then come to the tibia to extend the knee. You can also see coming off of the pubic symphysis, these groin or adductor muscles.